Hello, and welcome to the holiday edition of Nutrition and the Caregiver. My name is Denise Reynolds, and I'm a registered dietitian with Levine Cancer and Advocate Health. As the holiday season approaches, you may have already begun planning your traditional celebrations. Food usually plays a very important role in these events as a way to connect families and communities. Often these are centered around cultural, religious, and seasonal foods, as well as honoring our family heritage. However, if you have a loved one who is undergoing cancer treatment, your typical traditions may need to be modified a little so that everyone is able to enjoy the holiday together. November and December have many, many religious and spiritual and cultural holidays, only a few of which are listed here on the screen. Most of these have special foods that are part of the tradition. As a caregiver to a you may find that a few small changes can go a long way to making the day special. Poor appetite is a very common side effect of cancer and cancer treatment. Large meals may be overwhelming. Taste changes, even for favorite foods, may be a concern. This year, you might want to keep meals simple and pare back to just a few favorites. Make the meal special with your best holiday china and fancy glasses. And a tip for those who are using supplements such as Boost and Ensure, holidayify them. Here are some recipes to make a vanilla drink into something more festive. Smell is a powerful sense. Our nose is responsible for detecting airborne chemicals that can ultimately send signals to your brain. These smells often evoke nostalgia and comfort. They can influence mood, stress levels, and overall well being. And best of all, some smells may even positively affect the appetite. Cinnamon historically is associated with safety and warmth. There are some small studies that suggest that smelling cinnamon can increase the appetite. Before your guest arrives, place a pot of this wassail recipe on the stove and let the aroma fill the air. Another common side effect of cancer treatment is nausea. While some smells positively increase appetite, there are others may be overwhelming to someone struggling with nausea. If your loved one is having symptoms, prepare foods for the meal at your home and bring them to the gathering in sealed containers to help reduce cooking smells. Include cold dishes as part of the meal as another way to help reduce some of the offending smells. Some other tips: simple starchy foods are easy to digest. Plain lean proteins such as chicken and turkey may be well tolerated. Offer gravies and sauces on the side so that everyone can choose if they want to add them to their foods or not. Remember that it is okay to think outside the box when it comes to a holiday meal. What matters is that you're together. Certain spices have been shown to help with nausea. Culinary medicine is a discipline being increasingly recognized in cancer care. Adapting meals to support patients through their treatment is another way to provide great care for your family. Ginger is a spice that has been used for centuries to manage nausea. And what better way to eat ginger than in a ginger cookie? Peppermint is another holiday favorite that may help reduce the severity of nausea. This time of year, it is especially important to remember food safety practices. Your loved one may be at an increased risk for a foodborne illness, so it's especially important to wash your hands frequently and especially before preparing food. Use safe techniques when thawing foods to prevent bacteria from forming. Wash your fruits and vegetables, especially if you'll be eating the skin. Keep cutting boards clean. Cook all foods to a proper temperature. And at the end of the meal, promptly put your leftovers into the fridge to ensure that they're safe. Fatigue may also limit your loved one's ability to fully enjoy the holiday as much as they would like. Adapt your day to accommodate them as much as you can. Prepare as much as possible ahead of the celebration so that you can spend quality time with your family member. And if your loved one feels better in the morning versus the afternoon, have breakfast or brunch instead of dinner. Overall, make the day more slower paced, more flexible. Split meals into several courses, which may be helpful for those who feel full sooner with small amounts of food. Allow time for naps and keep visits short and meaningful. If the weather is nice, plan a stroll outside. The activity and the fresh air can do wonders for fatigue. And as the end of 2025 approaches, we here at Levine Cancer and Advocate Health wish you and your family a wonderful season. And here is to a happy, healthy new year.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.